With more than 40,000 members, the Academy of General Dentistry is the only professional association that exclusively represents the needs and interests of general dentists. It serves these professionals through a variety of publications, including the peer-reviewed journal General Dentistry, the news magazine AGD Impact, and more. Dr. Roger D. Winland, who has been the editor of these publications for more than 24 years, is now retiring. He's with us today to share some of the insights he has gleaned during his tenure, including how dentistry has changed, what changes may lie ahead. Dr. Winland, thank you for joining us today.
You're more than welcome.
Great, perfect. So can you tell us about your beginnings? How did you first get involved in the editorial side of dentistry?
Well, about 40 years ago, I was on the board of the Ohio AGD, and we had no editor. So at that time, I volunteered, and I was editor for the Ohio AGD for about 10 years. And I was also president of the AGD there. And one day, I always admired Dr. William Howard, who was our national editor, and he was retiring, and I was helped by 2 or 3 ex-presidents of the national AGD. They encouraged me to run. So I ran, and in Oregon, Portland, Oregon, I won election for the first time.
Okay, and when you first began your dental career, did you see yourself in an editorial role ahead in your future?
No, absolutely not. I never did anything editorial in my life until I ran for the national, or became the editor for Ohio, and I just found that the need there and tried to fill it.
Okay, did you have any other experience in terms of writing your own articles or conducting your own research before you got the role of editor?
Early in my career in the military, in the Air Force, I did some research and published a couple articles in some professional journals, but that was about it. Once I started private practice in 1974, I didn't pursue any editorial careers.
Okay, and when you first got involved as the editor of these publications, what were some of the subjects like? What were the most common or most significant topics that you and your team managed?
Well, in the beginning, the topics were usually aesthetics, and there was a lot of prosthetics, like full and removable dentures, which has tremendously slowed down since that time.
Okay. So is that one of the big changes that you've seen, the movement from prosthetics and dentures to a greater focus on implant dentistry?
Exactly. The prosthetics angle has gone down tremendously. Aesthetics and bonding agents and new techniques, that's the trend.
What are some of the other significant changes in research and other topics that you've seen during your tenure, in addition to the shift from prosthetics to implants? What are some of the other big innovations or revolutions that you've seen?
Well, aesthetics, botox, a lot of aesthetics, primarily research in that field has been the big push. Now, recently, there's been a slowdown in research naturally because the schools are shut down a lot and the money has dried up. What I've seen in editorials and things, Brazil is much more research oriented, and they have as many dental schools as we do in the United States. So that's one of the big things I've seen.
Okay, and looking back over your tenure, were there any particular experts or authors who have since distinguished themselves that you could point to say, hey, they got their start with our publications, or other experts who have contributed significant pieces to your body of work?
Well, I can't really say one or two. That would come from my acquisition editor.
Mm-hmm.
She knows the names and can just whip off names of great research people. I remember one doctor who really stands out in my mind, and that's Dr. Gremilian from LSU. But as far as a lot of research people, she has the names and numbers.
Okay, and what was particularly significant about Dr. Gremilian's work?
Well, Dr. Gremilian, not necessarily his work. I watched him receive his fellowship and mastership, and he was dean of that school, and he impressed me quite a bit with his the AGD. He promoted the AGD for us.
Okay, and in addition to some of these trends in clinical topics, one of the other big changes over the past couple of decades has been the rise of the internet. How has the digital world impacted the way the AGD has produced its publications and published its research?
Well, there's always, publications is expensive. The paper copy is expensive, and everybody thinks things should go digital. But when we do reader surveys, 90 or over 80% want the paper copies, even the young people, because they're tired of looking at screens and they want something they can sit down, hold in their hands, and read and put down if they want to, and then come back to. I think maybe possibly in the future some technique will arise that digital will work better, but for the time being, the paper copy is still here.
Okay, and also there's such a flood of information these days. Print publications are still out there, as you say, and also there's so many websites and webinars and continuing education courses online. How does the AGD manage this influx of information and narrow it down to what the most important things that dentists and other clinicians need to know?
The AGD, with its online education, is very much on the top of the curve. The blogs, the podcasts, the webinars are very, that we produce many webinars for our members to keep them current. And I think that could be one of the big futures for education.
Okay, do you think that the pandemic and how more people are just staying at home is having an impact on the importance of webinars and digital education?
Definitely. The pandemic has changed our view of the world and how we get our education, and it's troubling that the pandemic is so wide, is everywhere. And the stay-at-home professional has to get their education. Professionalism means getting up to date and staying up to date.
Okay, and one of the big issues that we've seen at Dentistry Today this year has just been the continuous updates of infection control protocols and social distancing and other measures to minimize the risk of infection. Are these topics that you're seeing in the AGD's publications as well? Yes,
we're seeing that. That's the key issue right now. And as soon as a vaccine or something comes along, maybe we can go back, but I doubt it. We've never, since the first time we ever had to have generalized precautions was when we had the HIV problem back in the 70s. And now the pandemic is just something further. It's very hard in a dental office to work with PPEs on and masks and shields, and I hope in the future we can cut back a little bit.
Okay, and also looking ahead towards the future, in addition to these infection control protocols, what are the big topics you're seeing right now that people are researching, and what do you expect to be the important research topics looking ahead in the next few years?
Well, right now, at the tail end of my tenure, all the research, and I usually get about 20 or 30 articles a month, but for the last 3 months, I've been turning that over to Tim Kaczynski, my associate editor, who will be the new editor, and he would have the recent research or trend in research that our organization's receiving.
Actually, Tim Kaczynski is one of our authors and editors as well. He covers dental implants for Dentistry Today. What's it like working with him from your end?
He's an excellent writer. He's an excellent researcher. That's why I picked Tim, and I was very pleased that he accepted to be the associate editor, and I'm very pleased that he's now the new editor.
Okay. In addition to him coming on board as to lead your editorial team, what other changes do you expect, or can you tell us about that are ahead for AGD and its publications?
Well, I really can't say what Tim has in mind. I'm sure he will have some changes, maybe format changes, or how he reads or goes through the research papers, or which research papers he picks particular. But we do a reader survey every 2 years, and hopefully that readership survey will guide him on his journey with the publications.
Okay, what kinds of questions are on that reader survey? What do you poll your readers about?
Well, you could get probably a copy of it. It's not secret. We ask many questions like, what are your interests? What research would you like to see? And there are generic questions like, where do you go to get your products and so forth? And there's a whole survey on the readership survey. I have used the readership survey for the 24 years because it tells me what the readers are interested in and how the trends are going, so that we keep up to date and current.
Okay, and over those 24 years in those bi-yearly surveys, have there been any interesting or significant changes that you've seen year to year and survey to survey that have really steered the publications in a particular direction?
Of course, with the increase of implants and research on that, we've definitely seen a decrease on articles about prosthetics, removable, partial prosthetics, full, complete prosthetics. It's a trend changer. Back when I started, we had like one composite, and now we've got 20 or 30 composites. So times change, and you have to, that's why we had the readership survey. Time makes us change our course of actions.
Okay, and one more question then, either looking back or looking ahead. Do you have any other comments about your tenure or the past or the future of the AGD and its publications?
No, I've had some great staff people. I've had 3. directors of communications, Joe Basalt, Kathy McNamara, and now Kristen Gover. And I've worked with those three people. It has been a tremendous journey. My wife has put up with a lot. She's helped me along the way and kept me going straight and not getting into too much trouble. So she's been great to work with. That's why my journey, why the 24 years went so fast.
Hey, well, great. And thank you for sharing your time with us, Dr. Winland, and congratulations on your retirement.
Thank you very much.